Hey everyone, I'm live. Yes. Okay. Wonderful. I hope everyone is having a great day so far. And I'm just popping on real quick in between patients and meetings all day to talk about the number one question parents have after I give them a diagnosis of autism for their child. Right. So when I'm doing the meeting where I talk about the results of the evaluation, parents, I always ask them first what their thoughts are, right? And I say, what are your thoughts? What do you think? Do you think your child has autism? Do you think your child doesn't? Just so I get a sense of where they are and how they are feeling about things. And so when they tell me what their thoughts are, then I tell them what I think, what the diagnosis is based on the evaluation. And the number one question I've had so far is, will my child be able to take care of themselves? Will they be able to learn? Will they have a meaningful life? And so I think that's a really deep question. And I know where parents are coming from, and I greatly understand that. So, answer to that is there's two answers actually. The answer to that is number one, we don't know because no one, and I mean no one, not even your family, no one can tell you exactly what will happen with your child or what your child's life will look like. So again, a diagnosis doesn't define your child. And that's one of my biggest messages to parents is yes, there's a diagnosis, but that does not determine the quality of life that your child can have. That does not determine who your child will be. That does not determine where your child will go and the kind of life they and the impact that they have, right? God made us all, and we can't always explain why things happen the way they do. But the first thing I always tell parents is I want you to see your child as valuable, see your child as they're still your child. The diagnosis didn't change anything about your child. The biggest thing now is okay, we have a diagnosis. What are the support systems we can place around your child, because that is what determines the trajectory of your child's life. Does your child need access to therapies like speech therapy, occupational therapy, physical therapy? Do they need access to applied behavior analysis therapy, or commonly known as ABA therapy? That's the important question. And often with the children I see in my practice, the answer is yes. And so, how can we place those supports around the child? If the child is school age, does the child need an individual educational plan, or short for IEP? And the answer often is yes. So, what are those things that your child needs to be successful at school? And we put those in place. At Glow Pediatrics, we believe in mind, body, spirit, right? So we are addressing what's going on with the child's body. What are the nutritional changes we can make? What are the environmental changes that we can make in your home so that your child's overall health can improve, so that your child's sleep can improve, so that your child's GI issues like constipation or loose stools can improve, so that your child's picky eating can improve, so that your child's behavior, aggressive or just not responsive, not engaged, whatever the behavior looks like, how can that improve? And that's what we look at. That's the other big pillar, the other big piece. And in my experience, once you put all those pieces together, the whole child, looking at the whole child, right? All of what's going on with the child on the inside, looking at support at school or at daycare, wherever the child is, looking at supports in terms of therapies. How can we put those all together so that we can give your child the very best support that they deserve, the very best, all the very best therapies that they need, get that in place, get support for you, the parents, because if our parents don't do well, our children will not do well. And that is a fact. So, what do you need as a parent? How can we teach you to communicate better with your child? How can we teach you to bond better with your child? How can we help you organize yourself so that you understand when you go meet with the school how to approach it? You understand when you go meet with the therapist how to approach it? When you meet with your pediatrician or your doctor, how they approach that. Those are all key elements to address. And so the answer is, it is entirely possible for your child to have an amazing life, to have a full life, as long as we put supports and the systems in place early. That is what determines the trajectory of your child's life. And of course, seeking favor from God, which we always do here at Glow Pediatrics. So that's my answer. And I want every parent to know that there is hope. A diagnosis does not define your child. Your child is way more than a diagnosis. And so I don't want you to look at your child and all you see about them is a diagnosis. Become a detective of your child. What are your child's strengths? What are the things that your child is extremely good at? Does your child see a sunset and can paint it? That's a gift. Does your child hear a song one time and can play it? That's a gift. Does your child hear songs in a different language and can sing it? That's a gift. You want to investigate what your child's gifts are and boost those. And that is how you change the trajectory of your child's life. So there is hope. Every child is valuable, and that's why we're here, to surround you with all the resources that you need to have the very best life possible. So reach out to us if you have any concerns, if you have questions, if you need an evaluation, reach out to us. If you need holistic care, reach out to us. If you need resource management, you're in a state, you have no idea what's available for your child with autism or ADHD, reach out to us. We can help. So have an amazing day. Remember, you're the best parents possible for your child, and you are valuable and you are seen, and we are here to support you. Have a wonderful day.